This educational clinical video presentation is brought to you by the Department of Surgery of the Chinese General Hospital and Medical Center. Today, we will present hernia signs and symptoms, diagnostic procedures, and treatment. Hernia is an abnormal protrusion of a viscous of a part of a viscous through an opening, artificial or natural, with a sac covering it. Hernia comes in several forms. Most commonly, there are either inguinal or femoral hernias. An inguinal hernia is a protrusion of the abdominal cavity contents through the inguinal canal. It is caused by either a congenital malformation or weakness of the abdominal cavity. This type of hernia is 20 times more common in men. Inguinal hernia has two types. First is the indirect inguinal hernia, which is more common in younger age group. Majority of hernias are indirect inguinal hernias, which is seen in patients with congenitally patent processus vaginalis. It can be detected in patients with reduced muscle tone within the abdominal wall and is exacerbated by activities that will increase intra-abdominal pressure, such as straining. The next type is the direct inguinal hernia. This type of hernia more commonly occurs in the elderly and is mainly due to an acquired weakness of the abdominal wall, leading to herniation of abdominal contents through the weakened portion. Another type of hernia is the femoral hernia, which is when the herniation is through the femoral canal. It is more common in women, especially in older age groups. As the patient ages, the femoral ring widens, thus increasing the risk of having femoral hernia. Risk factors for hernia will include the following: male sex, old age, chronic cough, smoking, constipation, and obesity. Patients with hernia will commonly present with groin pain on more pronounced during exertion. It is more common in younger age group, and as mentioned, most are congenital indirect hernias. Although hernias are diagnosed clinically, imaging such as CT scan, MRI, and ultrasound may help the healthcare provider confirm and visualize the hernial defect if necessary. Groin ultrasound is most commonly requested and is deemed as the best imaging modality since it is non-invasive, inexpensive, and has no risk for radiation exposure. Complications. Two of the most common complications of hernia are incarceration and strangulation. Incarceration is defined as the trapping of hernia content within the sac, resulting in the inability to replace the hernial contents back into the abdominal cavity. On the other hand, strangulation is incarceration with reduced venous and lymphatic flow of the trapped tissue, leading to blood supply compromise, ischemia, and eventually necrosis of the hernial content, which will manifest as severe pain and changes in bowel habits. For non-surgical options, watchful waiting is an option for the asymptomatic patient. For patients who are symptomatic or for those with larger defects, surgery may be done via open surgical repair or laparoscopic surgical repair. Herniotomy is the excision of the sac alone and is preferred choice for repair in children. Since the hernia occurs due to preformed sac and not due to a weakened abdominal wall, repair of the floor of the inguinal canal is not necessary. Herniorrhaphy is the excision of the sac with primary tissue repair of the floor of the inguinal canal. Hernioplasty is the excision of the sac with repair of the floor of the inguinal canal using a prosthetic mesh. Lastly, one of the newer options for hernia repair involves laparoscopic herniorrhaphy. There are two types of laparoscopic herniorrhaphy: transabdominal preperitoneal hernia repair (TAP) or totally extraperitoneal hernia repair (TEP). Both procedures involve the repair of the defect within the preperitoneal space by placing a prosthetic mesh using minimally invasive technique aided by the laparoscope. There are many options for repair of hernia, and it is always best to discuss these options with your healthcare provider to determine which is best suited for you. For more information about our services, visit the CGHMC website at cghmc.com.ph.